And hopefully that will help us answer that why question that is on the mind and on the lips of so many people, even at this early stage. Important to mention that Pete Williams from NBC also told us that federal sources are telling him that James Holmes did not have a military history. No military history, obviously big military population both in Colorado and in San Diego where he has family, but no military history. The feds are assisting the locals on this. It's still a local-led investigation, but it opens up the resources of the federal government, kind of streamlines the process, and allows them to run checks and to get information much more quickly than they would otherwise. This is a live picture from Sky 9 of the scene as it stands right now at the Century 16. And our understanding, the last update from Aurora Police, was that inside the theater are the bodies of 10 people who were killed there early this morning, and they're going to be working through the crime scene that's been described to us by many of the witnesses, including some folks who were in the front rows when the shooter came in the emergency exit, rolled that tear gas, and then started shooting. The one witness I still remember, her name was Jessica, speaking with Brandon Rittiman, talking about how she saw the shooter's gun just 3 or 4 feet away from her, laid down and played dead.
Yes. Others ran away, put their back to him and ran for their lives, literally. And then there were stories about some people just being trampled out of the panic. It's just, and the majority of the people, the police say, are young adults that went to this theater, but there were children there with their families.
Yeah. Stick with us. We're about a minute away from a press conference at the Medical Center of Aurora that took in a number of the patients this morning. Our own Will Ripley has been standing by there this morning. He talked to us about a reunion between a family and someone who came there with an injury, who fell to their knees in prayer as they reunited outside the hospital. Let's listen in now to that press conference.
I'm going to give you here in a minute, but before we do that, we've had a lot of questions from the media about the situation here at the hospital when the shootings happened and how the staff came together and how we manage a crisis. And so the first thing I'm going to do is introduce you to Tracy Lausen. She's a registered nurse and she's director of our trauma and ER services here at the hospital. And she's going to talk to you a little bit about the staff and what happened when the patients came in. So we're going to do that and then we're going to give you the patient updates. So I'm going to introduce you to Tracy.
Good morning. I could just tell you some highlights of what happened last night. So basically we started receiving some patients around a little after 12 last night. We had an amazing outpouring of resources from our sister facility, within ourselves internally, physician support, specialty physician support. It has just been awesome. Obviously our priority right now is taking care of our patients and our families. Social workers have been brought in to help with that. We have pastoral care here. We have licensed social work clinicians that are able to help. So today that's what we're going to be targeting on. I just want you to know, as a level 2 trauma center, this is stuff that we train for all the time. We hate that we had to do this. We hate it. It's a tragedy for our community. But you need to know that it was a calm, organized group effort, and these people got amazing care. And I'm very proud to say that I work here at the Medical Center of Aurora. Any other questions? L-A-U, Z as in zebra, O-N.
What's your first name?
Tracy, T-R-A-C-Y. And I'm the director of EMS and Trauma Services. Is that okay?
Can you describe a little bit about the atmosphere?
Sure. I can tell you that when the first trauma surgeon responded this morning for the first case, obviously she wasn't aware of anything else that was going on. When she heard more about what was going on, she said it was just automatic. ER staff called. She didn't have to say anything. They basically called everybody that they needed to help with as far as getting the patients the care that they were going to need. She said it went very smoothly. It was not chaotic at all. It was just very well organized and awesome.
Tracy, did you have to call extra people in right away?
Yeah, we did. As soon as we heard that there was, and I, don't quote me on this, but once we knew that there was going to be more than one victim coming, we just went ahead and called in we have backup surgeons for trauma, for anesthesia. The neurosurgeons were here, orthopedic surgeons were here. I mean, it was just awesome.
How many people